I'm very interested in affordable care. There is a lot going on at the moment about the costs of cancer care. So cancer is a terrible problem. We all know that. It causes great issues for patients, and the care pathway is difficult. And on top of that, they have issues about money. And governments have issues about money. So we are looking at how we can manage this issue to deliver affordable cancer care for all countries. So we're starting in high resource countries, but this is definitely applicable to middle and low resource countries also. So what we want to do is to think about the issue of the patient pathway, because we think that if we can understand the patient pathway and develop an optimal patient pathway and reduce overdiagnosis, reduce waste, reduce overtreatment, and provide high quality care, we will get cost-effective care. So this is the key issue, getting cost-effective, value for money care. And if that's the case, I believe that most countries will be able to afford it. Now, the actual amount of money which is lost in the health system is not really known, but we do know that there's a lot of evidence of waste, of overtreatment and overdiagnosis.
And how are you going about doing that? You're doing it here in Victoria? Firstly,
we have two main thrusts to this. Firstly, we have a large forum, which is the WISH forum going ahead, which will be discussed in February, and a document produced at that time, which will put forward the views which can be picked up by the policymakers and the health administrators, because this is a high level issue. It's not going to be done at the lower level unless there's very compelling arguments put to the professionals. So I'm a great believer in professionalism. I think we have to return to putting the pressure on our professional colleagues to make sure that they do treat their patients according to this sort of pathway. So we know a lot about guidelines. We've had guidelines for many, many decades really, and we know the problems about adherence to guidelines. I actually think that professionals will understand what the right treatment is, but what they don't understand is providing efficient treatment. They need help in making treatment decisions about end-of-life care, when you introduce palliation, how many scans should an early breast cancer patient have? They don't need any actually, because there's 98% survival from breast cancer in an early stage. So these are the sort of things we're working on. To implement this sort of program is quite complex, because it introduces a new or a regular problem we've known about for a long time. That is, how do we get data? How do we infuse the pathway with data? And how do we infuse the pathway with costs? So we think that having this in a transparent way will also be helpful. We think the decision should be a discussion occurring between patient and the doctor and the health system about their pathway and how they want to go. Now, I actually believe that doctors will conform to the pathway if they understand the issue, and mostly they don't. They look at an isolated issue, an isolated item of care, an isolated problem they have to deal with, and then they don't realise that there's another step. So these are the sort of things we want to work on.
And the issue of survivorship is now becoming real.
Absolutely. Survivorship is a big area of action. And I think survivorship, which essentially means let's work out how we can manage patients after they've finished their treatment. There is a lot of talk about whether survivorship issues start earlier, but I think they basically occur after the treatment is over. And the real point is that to both improve patient experience and also keep the patients out of the medical system. I personally think if I get cancer and I get treated for it, I'd be very happy never to see a doctor again, and I'm happy to see someone who can help me with my thoughts and my concerns. I had a patient once who was treated, and she had a nasty cancer. She had an anal cancer, and they treat anal cancer with chemoradiation, and she was treated and she was cured of her cancer. She came to see me for follow-up, and she said, "Oh, I'm not very happy." I said, "What's your trouble? You've been cured of your cancer." She said, "That is the issue. I've had cancer. Nobody tells me how to manage that issue. When I go to the golf club, all they want to know about is cancer, and it's driving me mad. And I have problems following the chemoradiation. in that neck of the woods down in my pelvic region, and no one's interested. And so this is survivorship, and there's a case for demedicalising survivorship, taking it out of that medical arena and having patients managed in a way which helps their experience and also reduces cost and reduces burden on the medical system.